No more anxiety. Experiencing anxiety occasionally is a normal part of life. However, people with anxiety disorders frequently experience intense, excessive, and persistent worries and fears about everyday situations. These feelings of anxiety and panic interfere with daily activities, are difficult to control, are out of proportion to the actual danger, and may last for a long time. Common signs and symptoms of anxiety include feeling jumpy, restless, or tense, having a sense of imminent danger, panic, or doom, experiencing an increased heart rate, shortness of breath, hyperventilation, sweating, tremors, feeling weak or tired, having trouble concentrating or thinking about anything other than what you are currently worried about, having trouble sleeping, developing gastrointestinal (GI) problems, having trouble controlling worries, anxiety that desperately wants to avoid things that trigger your anxiety. There are several types of anxiety disorders, including 1. Agoraphobia is a type of anxiety disorder in which you fear and tend to avoid places or situations that cause you to panic and that put you in a difficult, helpless, or embarrassing situation. 2. Anxiety disorders caused by physical conditions involve intense anxiety or panic symptoms that are directly caused by a physical health problem. 3. Generalized anxiety disorder involves persistent and excessive anxiety and worry about activities or events, even if these are ordinary, everyday problems. The worry is out of proportion to the actual situation, difficult to control, and affects how much you feel physically. It often occurs with other anxiety disorders or depression. 4. Panic disorder involves multiple episodes of sudden intense anxiety and fear or terror that peak within minutes. Panic attacks. You may experience feelings of doom, shortness of breath, chest pain, and a fast or pounding heart, palpitations. These panic attacks may lead to worrying about them happening again or avoiding situations where they have already happened. 5. Selective mutism is a consistent disorder in which a child does not speak in certain situations, such as school, but is able to speak in other situations, such as at home with close family members. This may interfere with school, work, and social functioning. 6. Separation anxiety disorder is a childhood disorder characterized by anxiety that exceeds the child's developmental level and is related to separation from a parent or someone else who plays a parental role. 7. Social anxiety disorder, social phobia, involves high levels of anxiety, fear, and avoidance of social situations due to feelings of embarrassment, self-consciousness, and fear of being judged or viewed negatively by others. 8. Specific phobias are characterized by severe anxiety when you approach a specific object or situation and a desire to avoid it. Phobias provoke panic attacks in some people. 9. Substance-induced anxiety disorders are characterized by intense anxiety or fear symptoms that are directly caused by substance abuse, medication, exposure to toxic substances, or withdrawal. 10. Other specific anxiety disorders and non-specific anxiety disorders are terms for anxieties or fears that do not meet the exact criteria for any other anxiety disorder but are severe enough to cause distress and disruption.